Hello, Dr. Chidi Ufundu of Snowspirations Global Health Solutions. So this weekend, we're going to look at the common mistakes most couples that want to start their family make. Very common misleading mistakes, which can actually prevent you from becoming pregnant and starting your family as soon as possible. The very first mistake, especially that women make, it's the inability to study their body, to know when they ovulate, to know when their cycle is. So if you don't really have an idea of how your body works, so what do I mean by how your body works? As a woman that wants to start her family, you are supposed to know your cycle. So knowing your cycle will give you an idea if you have some problems, if you have some challenges. So in that regards, you are supposed to know if you have a normal cycle. The normal menstrual cycle in a woman ranges from 21 days to 35 days. So if you bleed every 21 days, it's normal on the lower range. If you bleed every 35 days, it's normal on the upper range. So it's a range. The commonest cycle you will have out there is 28 days, but it's not all women that will have 28 days. So if you've been making the mistakes of not knowing your cycle, not knowing the likely period you're ovulating, spend some time, study your cycle, put it in a calendar, track it. Notice some changes in your body. Like, for example, when you're ovulating, there are a couple of changes you will notice in the middle of your cycle. Increase in cervical mucus, increase in your basal body temperature, increase in libido, being moody, and all that. Some women can spot, some women can have some pain. They are all in keeping with when you ovulate. Remember that for you to become pregnant, you have to ovulate. When you ovulate, that means you release the eggs. When you release the eggs, the sperm can come in and play the role. So that's number one mistake that most couples make. Number two, timing your lovemaking. Thinking you are ovulating at a particular time and only limiting your lovemaking within a particular days in your cycle. That's a very wrong way to go about it. The reason is because there are some factors that might lead to fluctuations in your cycle. So some women can actually think they are 28, 29, 30, but for some reasons, they might be exposed to some factors that can flip their cycle from 28 to 24 to 25. So we don't encourage timed lovemaking. What we encourage is regular lovemaking every other day. Every other day means if you make love today, you give yourself a break the following day, then you continue the other day. The idea is to increase your probability of becoming pregnant because so long as you have healthy sperm available and the egg is released at any time, possibility that the sperm will get the egg fertilized is very high. The understanding is the fact that the egg stays only for about 24 hours, which is approximately 1 day, whereas the sperm can last up to 5 days. So the idea is to deposit as much as possible healthy sperm just around the vaginal area, the cervical area, and the womb, so that whenever the egg is released, you can easily go and get pregnant. Number three, clinging to your unhealthy habits, which you might not really know might have effect on your ability to become pregnant. So some women still cling to drinking, some men still cling to drinking, smoking, not watching their body weight. Now, these factors might not necessarily contribute to infertility directly, but overall, they can indirectly impact how soon or how later you can become pregnant. So if you are currently ready and you and your partner are on the same page, you have to modify your lifestyle. There are certain things you have to stop doing immediately. No smoking, no alcohol, no processed foods. Then you have to also modify how you look at things. You have to avoid stress. So adopting a healthy lifestyle will help you to become pregnant. Number four, not getting enough sleep. Sleep is very huge when it comes to normal functioning of your reproductive hormones. When you sleep appropriately, of which the range is from 7 to 9 hours, when you sleep, Your hormones are going to be in a better place. They will regularize. And when they regularize, you will have an opportunity to have the hormones to perform their role. And eventually you will become pregnant. So sleep is going to help you a lot. Now, also when you sleep, you will tend to be in a better place. And when you tend to be in a better place, you will reduce the possibility of having anxiety that can lead to stress that can affect your hormones. And of course, if you have hormone imbalance, you're going to have infertility. Number 5, waiting for too long to go to a fertility specialist. You see, as a woman, you are already programmed. So you have to be conversant with the time frame you need to start seeking help. And the cutoff point is 35. So if you're currently believing God to become a mother and you are not yet up to 35, please go home and practice PPP for at least 12 months, 12 completed months. That's if you're below 35. At the expiration of the 12th month, if pregnancy doesn't happen, then at that stage you have infertility. If you are already above 35, your time frame is 6 months. Make sure you're praying every day. Make sure you're making love regularly. Remember, your regularity is every other day. At the expiration of 6 months, for women that are above 35, at that point, you have infertility. That's the point you need to start seeking help. So don't wait for too long to seek help from the appropriate fertility specialist. Don't go seeking help from the wrong places because some of them might damage your reproductive organs, and by the time you're showing up, it will be too late. So time is of essence. The best person to attend to your fertility problem is a fertility specialist. Now, you can start with your family doctor who can refer you to a gynecologist, or if you have a direct access to a gynecologist can refer you directly to a fertility specialist. A fertility specialist will look at you guys to see where the problem is coming from. So don't wait too long. Make sure you go at the appropriate time. Now, some other mistake that most couples, especially men, will make is to blame everything on the women. So there is this general assumption that once a woman is not able to become pregnant, the problem is coming from her. That's completely wrong. Infertility is a 50-50 thing. Infertility can be coming from the man. Infertility can be coming from the woman. So it's not only women that will have problems in getting delayed. It can be from the man. So what is that supposed to mean? Make sure you present yourself with your partner so we can check your partner and check you. Then if we discover what the problem is, we can begin to solve the problem. Men and women contribute virtually equally to problems of delay in becoming pregnant. Men actually contribute up to 40%, and women contribute about that 40%. Then the other percentages are equally shared. So infertility is not just a woman's problem. Infertility is a problem of the two couples. So the earlier you understand this, the better you can begin to know what your situation is. Now, another mistake that most couples make is to actually go too soon in seeking help. Now, if you're a newly married young lady, probably in your 20s and your 30s, you just got married a few months ago, and you've already started worrying whether you're going to get pregnant. That's too early. Relax. Go and enjoy the dividends of your relationship with your partner for 12 months. So remember, the cutoff point is 12 months if you're below 35. If you're above 35, 6 months. Now, if you have a pre-existing condition prior to getting together, like some women might have an already diagnosed gynecological problem, you're not supposed to wait. You're supposed to start acting almost immediately. So it's important to avoid all these aforementioned mistakes so you can fix them. If you notice they are fixable, you can reverse whatever knowledge you think you have, and you can do the right things. And when you do the right things, you will improve your possibility of becoming pregnant. So please, as we are getting ready to end 2023, I see you a mother, a father in 2024, and you can still become pregnant for the remainder of 2023. So make it a point of duty to correct all those wrong impressions, to correct all the mistakes I've mentioned, and practice the right thing so that eventually you become pregnant And by the special grace of God, you become a mother, you become a father in 2024. Thank you so much for coming, and bye bye for now.